Welcome to ENT channel. Today I will show you how a large traumatic eardrum perforation heals eventually in few weeks. This is the day one when you can see a very large perforation with the blood around the margin of the perforation and the middle ear space can clearly be seen. This happens like that a boy slapped another boy in the classroom, and when the horrified mother visited the clinic, I consoled them and told them that nothing would happen, just take care of an infection or water going inside. And the mother followed the steps and a weekly follow up. For comparison, you can see the other side eardrum as well, which shows a normal eardrum, which is very beautiful. This is just for comparison who have not seen the normal eardrum. Keep seeing the video till the end because you would understand, because I am showing you the real images, real hard work. Now the patient visited me on the 7th day, and you can see the blood has clotted here, and the margins are much more well defined here. There is no sign of infection. That what I see in every visit of the patient. I call them weekly because I can also take look into their noses or any throat, because sometimes patient is not aware of any allergy or this thing infection, which I can look them. So this was good sign of healing, and even young boys shows very early healing compared to the older persons. Again, I always make a habit to see another ear. I don't. I always see. So again, you can see the other ear as well. Now the patient is again visiting me on 21st day, and you can clearly see there is a much reduced size of the perforation. Clots are very much organized, and the maximum healing I can say it happens in the third week. And eardrum is almost reduced by 50%, and the child was very happy when he started noticing further improvement in hearing. And again, I warn them, don't take it lightly, don't go outside, no water going inside, don't meet your friends or small kids. Another, the child is visiting me on 21 day, again you can see that it is reduced by 1/3, very small perforation. And these claws are well organized, and size is almost 1/3 what I was, and even child was pretty happy. Still the mother was apprehensive. We wanted to see this drum healed completely, and everything is going well. So I gave few medicines, kind of on SOS basis, like nasal drop if nose is blocked, anti-allergic if he happens to do sneezing. And I warn them not going in rain, not going in swimming. Again, same instruction every time and time. And this video is getting longer, so I'm cutting here. Now then the child visited me on 35th day. Maybe he had examination, and this by this time I don't see any hole, but to my surprise there was some crust over the hole. So this was kind of a mixed feeling, but I didn't wanted to clean it and remove the crust, because I know a wound heals by formation of scab or crust over it. So I thought I can have called the boy again, and but I don't wanted, but I didn't touch the crust. Most probably I told them the this thing had healed, we can have another look, another visit. But this time he visited me after 4 months. So 4 months, see the you can clearly see the eardrum had healed nicely. There is hardly any perforation. There was some dried wax and the clot which was there quite laterally in the ear canal, and you can see the beautiful eardrum. Then I asked the boy to do a Valsalva maneuver, like closing your nose and closing your mouth, and you can also see the eardrum moving. So this had healed nicely. I hope, though slightly lengthy video, but you could have known the silent point of this thing, that the eardrum heals maximally during the third week of the injury, and if you can prevent, eardrum heals almost 99% of the time. I hope you like this video. If you have liked, please click the like button, and don't forget to switch on your bell button and subscribe the channel for future update. Thank you for watching ENT channel.